Okay. Welcome, everybody. My name is Rachel Kiesler, and I am a Family Support Coordinator with CTFSN. And we're partnering with Connecticut Dental Health Partnership today for this lovely workshop, and we thank you all for joining. It is going to be in English and in Spanish, and we are going to have save time for the end if you have any questions. If you do have a question during the PowerPoint pertaining to something on the slide, you can definitely ask a question. If you want, you can put it in the chat, and Adriana and myself will be monitoring the chat, and we can interrupt, sorry, Elaine and Luis to have that question answered. Or if it's something that's not pertaining to what's in the PowerPoint, we will wait to the end. And then, like I said, if you have any other questions, we can wait until the end to have those questions answered. And next, I'm going to have Adriana introduce herself.
Hello, everyone. I'm Adriana, and I'm a CTFSN Bilingual Family Support Coordinator. Bienvenidos todos a este taller de Dental Salud. Quería dejarles saber que todo el mundo vamos a tener las preguntas en chat. Elaine va a presentar en inglés y Luis Miguel va a presentar en español. Cualquier pregunta que tienen, póngalo en el chat. Si tiene una pregunta particular en lo que está mirando en la pantalla, puede ponerlo, o también puedes preguntarlo, quitarse de mute y puedes preguntar y ellos te pueden decirte, ayudarte con su pregunta. Esto está siendo grabado y lo agradecemos a todos estar aquí con nosotros a aprender cómo conectarse con la salud dental. Right now I'm going to present next Elaine.
Okay, bienvenidos everyone. Good evening. My name is Elaine Spinato, and I am a dental healthcare specialist with Connecticut Dental Health Partnership, which is also the Connecticut Husky. And my colleague, Luis Miguel Ayala, and I will present what this plan is all about and what it offers and how valuable it is to you and your family.
Good evening, everyone. My name is Luis Miguel Ayala. I'm a dental healthcare specialist for the Connecticut Dental Health Partnership. This is the dental plan for Husky Health members. Tonight, we will be basically giving you a brief overview, and truly we want to have a conversation. So if you happen to have questions, suggestions, or any feedback regarding dental services on the Husky Health program, we will be happy to help you. También hablo español, así es que si usted tiene alguna pregunta, puede hacerlo en la parte de chat, o si no, también levantar la manito y hacer su pregunta en el idioma español. Muchas gracias.
Can everyone hear us okay? Because I know there's a lot of us here. Everyone, volume okay for everybody? Okay.
Sounds good. All right, Elaine. Okay.
Not Luis, okay.
All right.
Okay, so as we mentioned, this is the dental plan for Husky. It is administered by Benicare Dental plans, and we are subcontracted with the Connecticut Department of Social Services.
Thank you, Elaine. Nosotros básicamente somos el plan dental para el programa de Husky Health, ese seguro también conocido como Medicaid en el estado de Connecticut. Es administrado a través de un plan corporativo llamado Benicare, y esto es un contrato que se realiza a través con el Departamento de Servicios Sociales. Okay, Elaine.
Okay, so you have a dental plan, and it's a very good dental plan. It's better than any dental plan that I know of. So these are the cards that you have that will identify you as a Husky member. So it's very important to have these with you when you go to your dental appointment or any appointment. On the left is the gray card, which has your name and identification number on it. Likewise, the Husky Health in the middle. And on the back of the card will be some different numbers that will be valuable to you. Member services, you have health services, dental, nurse line, transportation, provider services, and pharmacy. So these are really valuable cards. And, you know, as I say, bring them with you to all your appointments.
Thank you, Elaine.
Mhm.
Perfecto. Estas tarjetas que ven ustedes en la pantalla, básicamente lo identifican a usted como miembro del plan de salud de Husky. Son muy importantes que las tenga presente en cada visita que realice con un participante médico o dental. En la parte de la izquierda tenemos básicamente lo que identifica a usted en la tarjeta gris como miembro del programa de Medicaid. Y en la parte derecha tenemos la parte frontal y reversa. En la primera porción tenemos lo cual va a identificarlo a usted con su nombre. Y en la parte de atrás tenemos números, los cuales son muy importantes si usted quiere tener acceso a los servicios, ya sean médicos, servicios de salud mental. En este caso específico, el servicio de salud dental, que es importante. Ahí está el número con el 1855. También le vamos a dar la información más adelante, pero esto es información que a usted lo identifica como miembro y si tiene esta tarjeta, tiene beneficios dentales. All right, Elaine.
Okay.
Next.
Okay, so what we want to do is to enable every Husky member to maintain good oral health. So what we do for you is when you call the member services number, which is on the back of your card, you will get someone in our call center. You can tell them what you need. You just need to identify yourself. Our call center can give you referrals. If the case is a little more difficult than what they can do, then you'll be referred to one of us. We are the care coordinators and can take your case a little bit further. Say you have a special needs child. Say you have certain barriers that you need some help with. That's where we come in. We collaborate with many agencies. You know, our goal is to get what we call you into a dental home. It's not a good idea to bounce from dentist to dentist. You want to pick a dentist and stay with them. That being said, you don't have to stay with them if you're unhappy with the care. That is why we are here. We want to make sure we respect your cultural and sensitivity. We want to be there for open communication. We want to focus on prevention so that your dental issues don't become emergencies. That would be devastating to you. Most of all, we want to make it easy so that we can get you a dentist. And we have many, many dentists out there who accept the Husky plan.
Thank you, Elaine. Muy bien. En esta versión en español, básicamente nuestra misión es ofrecer a todos los miembros de Husky Health la posibilidad de alcanzar y mantener una muy buena salud dental. ¿Cómo hacemos esto? A través de 5 puntos. Una, tratando de brindar a nuestros miembros el servicio de coordinación de cuidado en casos de que hay familias que tengan niños con cuidados especiales. Sabemos la importancia de estos servicios para estas personas. Entonces, tratamos de apoyarlos, darles asistencia con citas, buscar especialistas que tengan la capacidad de atender a estos niños. Entonces, recibimos estos casos y como cuidadores, trabajadores de casos, tratamos de ayudar a que estos niños obtengan los servicios, mantengan un solo lugar como dentistas y no tratar de ir de oficina dental en oficina dental. Establecer una oficina sería lo ideal. También lo hacemos con colaboración, por eso estamos esta noche haciendo esta presentación. También colaboramos con muchas agencias interestatales y sin fines de lucro a nivel del Estado. Que es importante también que la comunicación sea respetuosa y culturalmente sensible entre nosotros y a los miembros que servimos. Hemos dado cuenta de que dar el mensaje en un idioma en el cual usted sea cómodo va a facilitar la obtención de servicios. Nos enfocamos básicamente en la prevención, en que los niños atiendan yendo al dentista, obteniendo un examen, una limpieza que es importante, y también haciéndolo fácil. Esto quiere decir de que puede llamarnos por teléfono, puede acceder a la página web, puede hacer un pequeño like en Facebook a través de medios sociales, y nosotros podemos brindar la ayuda. Alrighty, Elaine, you can go ahead.
Thank you, Luis. Sí. Okay, so one of the things we have established recently is the Connecticut Dental Health Partnership is committed to achieving oral health equity. We want to ensure that oral health services are fairly distributed across the Husky health population. And we use data-driven strategies to reduce barriers to services. So we want to make sure that everyone that has the Husky plan is entitled to as many dental services that are offered under the Husky plan. So that is one of our highest goals.
Thank you, Elaine.
Mhm.
Okay. Básicamente, esta parte es acerca de compartir con ustedes que nosotros también nos importa la equidad en la salud dental. ¿Qué quiere decir esto? Que nuestro compromiso es asegurarnos que los servicios dentales sean distribuidos de manera justa para todos los miembros en el programa de Husky Health. Para este motivo, usamos estrategias basadas en datos, basadas en estadística, en reportes que nos den la información donde los servicios o donde los miembros necesitan más ayuda, en qué áreas, ya sea geográfica o en qué área cultural, dependiendo del idioma, sea necesario. Y es de esta manera en que nosotros hacemos este trabajo basado en la data que recibimos. All right, Elaine.
Thank you, Luis.
Mm-hmm.
Okay, so Husky members can call our service center. You will always speak to a live person. You will not be put on hold. You will speak to somebody who will give you as much time as you need to ask for a referral, describe what your problem is dentally, and if your case needs to be escalated to one of the care coordinators, which is what Luis and I do, that is what will happen. So you can always call and be assured that someone will identify what you're looking for and help you right then and there. They will help you find a dentist. If you need a general dentist, which is the dentist that does cleanings, fillings, exams, if you need a referral to one of the specialists, such as if your child needed braces, if you need an oral surgeon, if you needed to go for a root canal. These are specialists that we can help you make an appointment for. We can also make sure that the appointment is timely. We expect to get you in to see a dentist if it's a routine, call, a routine appointment that you need to make within, I would say, a week to 10 days. If it's an emergency, much less than that, usually the same day or the next day. We have translation services that can help you. So most of the offices are bilingual or multilingual. If they are not, we do provide translation services for a variety of languages. We do have transportation assistance, which is through VEO Transportation. And so that is something we can help coordinate for you. And we, most important, can answer questions about your benefits. The Husky benefits, there are many of them. But your care is also only allowable what's accepted under Husky, what they allow. But it's a wonderful plan, and really people that have this Husky plan should really take advantage of it.
Elaine, can I ask a question?
You can.
Does Husky cover braces?
I was going to explain that. Braces are covered, what's called, it's scored under a certain amount of points. And it is only, it is not for cosmetic purposes. It is for, structural issues. What will happen is that the child will be sent to an orthodontist who will score the case, submit it to the Husky plan, and it's determined based on that number of points if the child is eligible. If the child is denied, you have a right to go to a hearing if there are some documents that you need to present, say if the child has been seeing, many things could play into it, congenital issues or things that we're not aware of. But it is something that is scored specifically under a certain amount of points.
Good to know. Thank you.
You're welcome. Okay, Luis.
And you know what? I'm going to translate that question in Spanish too, right at the end of this.
Okay, right.
Now, that's a good one. That's a good one. Always comes up.
Yeah.
Perfect.
Yeah. Yes.
Okay. Básicamente, en este pantallazo le estamos dando a nosotros saber de que cómo nos puede contactar es a través del centro de llamadas. Nuestro centro de llamadas está ubicado en Connecticut. Está acá para servirlo. Va a hablar con un representante en vivo. Lo va a ayudar a encontrar un dentista. Si es que necesita un especialista también. Ocurre que nos llaman cuando hay casos de emergencia, hay casos de visita rutinaria. Típicamente, si es una visita rutinaria y necesita los nombres de dentistas o necesita hacer una cita incluso, lo podemos ayudar a hacer eso. Tomaría de 7 a 10 días hacer esta cita con un dentista para que el pequeño o la persona adulta obtenga cuidado. En caso de una emergencia, podemos hacer el esfuerzo en que la persona se acuda y atienda el mismo día de la emergencia o quizás el día siguiente. Tenemos los servicios de traducción. Muchas de las oficinas tienen personal bilingüe, ya sea en inglés o español. Y en caso de que necesite otro idioma que no esté en la oficina, también nosotros en el centro de llamadas podemos atender con la línea de interpretación. Esto ocurre para todos los miembros del programa, ya sea de Husky A, B, C y D. Tenemos respuesta a todas sus preguntas y hubo una muy buena pregunta de Rachel acerca de si los servicios de ortodoncia o frenillos son cubiertos por el programa de Husky. La respuesta en corto sería sí, pero hay una pequeña exclusión, la cual es que cada caso necesita ser evaluado por un ortodontista y hay un sistema de puntos. Para calificar, usted tendría que tener 26 puntos a más. Entonces, lo bueno sería que usted acuda, o el pequeño, a tener un asesoramiento con un dentista, en este caso un ortodontista, para ver si califica o no. Cada caso depende de la situación del pequeño. Puede haber otras complicaciones, otros diagnósticos médicos, los cuales puedan que este caso se apruebe. Okay. I'm going to continue. I just answered Rachel's question in Spanish as well, so we're good to go.
Okay. So the care coordination and outreach, there are 7 dental healthcare specialists that cover 6 regions of the state, and they are highlighted. You'll note that there are the western part of Connecticut, northwestern, eastern and southeastern. We have the Hartford area. We have Greater New Haven area. We have the Greater Bridgeport, Norwalk area. So we have a dental healthcare specialist for each of those locations. And I am I'm the 7th person, so I cover the entire state when it comes to clients with special healthcare needs. And so that's what I focus on. Our members that are presented to us that might have medical issues, multi-medical issues, psychiatric issues. And we work with them and perhaps their medical providers, their psychiatric providers, to get a better background as to what the client's needs are. And then we will schedule them accordingly. So all of us are working in specific areas of the state. And one thing to note is that the dental healthcare specialists that work, they actually live in that area as well. So they are well versed in what's going on in that area.
Thank you, Elaine.
Luis?
Right, so tenemos un equipo que básicamente se encarga de coordinación de cuidado y difusión o promoción del programa en el estado. El estado está dividido, en estos momentos ya lo ven en el mapa, en 7 regiones. 6 regiones. En cada una de estas regiones hay una persona o un individuo que es básicamente tiene mi rol como cuidador de perdón. I'm sorry about that. Como cuidador de los casos y también provee la ayuda para las personas que necesiten este tipo de servicio. Hay una en cada una de esas regiones. Esta persona también vive entonces tiene más conocimiento acerca de la comunidad y cómo puede, y a qué servicios puede la familia o la persona adulta acceder. Ah, Elaine es la que se encarga en todo el estado de ayudar a personas con o familias quienes que tienen pequeños con cuidados especiales. Ella tiene relaciones con también personas profesionales médicas, las cuales pueden ser desde el espectro psiquiátrico hasta una persona que sea solamente de médico de cabecera. La importancia es que tenemos la ayuda para brindar a tener acceso a los servicios dentales, ya sea con dentistas generales o especialistas. All right, Elaine.
Thank you, Luis. Okay, so things to note about Connecticut. We are the second highest rate of preventative dental, whoops.
Sorry.
I know some Spanish, but not that much. Okay. We're the second highest rate of preventative dental services for Husky Health members, ages 1 to 20. We are one of only 21 states in the country with extensive Medicaid adult dental coverage. That means that some states have no coverage. Some states offer palliative or emergency coverage. Some will offer only slight, preventative coverage. Connecticut Husky offers a lot of things, but it's also good to note that it is functional dentistry. It is not cosmetic, so we need to make that distinction. If you're looking for, teeth to be whitened or, the implants, those things are not covered, but they're not covered by any insurance. So Husky is really quite a wonderful plan. We have over 1,500 dentists enrolled in the Husky plan throughout Connecticut to meet the needs of the Husky members. And that number is always growing. So, there used to be days where people would say, oh, Husky, it's a terrible plan and you can't find any dentists. That is no longer true. People are envious of what Husky covers. Luis, you're next.
Okay, Elaine. Yes, I had to unmute myself. I'm sorry. All right.
Okay.
Let's do this. All right. Esto es lo que nosotros quisiéramos que supieran un poquito más de nuestros logros en Connecticut. Tenemos la segunda tasa más alta de servicios de prevención dental en las personas hasta los 20 años de edad. Hemos sido reconocidos ya múltiples veces en los años y estamos orgullosos de este logro. Algo importante que debemos de saber es que solamente 21 estados poseen cobertura dental en la nación. Entonces, somos un programa que en realidad somos afortunados de tenerlo en Connecticut. Por lo tanto, si lo tenemos, hay que sacarle el más provecho posible. Y si usted no ha establecido una visita o no ha visto al dentista en el último año, es importante tomarse un tiempo. Yo sé que en este periodo de la pandemia nos ha tratado de evitar de tener el chequeo rutinario, pero cuando se sienta cómodo de acudir, los dentistas en nuestra red están dispuestos de verlo. El acceso es importante. Tenemos más de 1,500 dentistas que participan en el programa. Esto quiere decir que el acceso físico básicamente está casi derrotado. Podemos tener acceso a los servicios. La importancia es acudir y hacer una cita lo más pronto posible. All right, Elaine, you're next.
Thank you.
Mm-hmm.
Okay, so a quick view of what your dental benefits are. Oral exams, very important. Even if you have dentures, you still need an oral exam because they want to check your gums and make sure that your gums are healthy. Cleanings, you get 2 a year if you're 21 years or younger, and 1 a year if you're 21 years or older. However, if there is a demonstrated and ongoing medical issue in any of the situations, cleanings can be increased, but that has to be prior authorized. So in other words, if you are a patient, a person that has seizure disorder, you might be on certain medications that affect your gums, and that may require extra cleaning. So there are instances, there are exceptions, okay, but that's generally what the rule is. Sealants, which is a plastic coating over your teeth. This is for children mostly, to prevent tooth decay. And it's just brushed on, so it's not anything invasive, and so it's very important to have that. X-rays, of course, to diagnose what's going on, because without X-rays, I don't know anybody that can look at a tooth and say, okay, that's what the problem is. The X-rays are needed. Fillings are covered, extractions. It's kind of important to note that extractions are only done when they are absolutely necessary. If the tooth is savable, it will be saved at all costs. But if the tooth is broken to the point where it can't be restored, then it will be extracted. Partial and full dentures, good to note that they are covered once every 7 years. So, you know, it can't be done every year or every 2 years. It's once every 7 years for partial or full dentures. Root canals are covered, as are crowns. Good to note that once you have a root canal, then you must have a crown over that. Otherwise, that tooth will just sort of break down, and you will have gone through a root canal for no reason. Nobody wants to do that. Oral surgery. So, for instance, if you needed your wisdom teeth extracted, or you needed extractions done before you get dentures, that is covered. Orthodontic services, as Luis Miguel and I explained, under 21 only, and prior authorization must be obtained, and you must qualify with, is it 25 points, Luis Miguel, or 26?
26.
26, thank you.
Yes.
You know, it's a wonderful plan. It covers, as I mentioned, functional dentistry. Cosmetic dentistry is something that's not covered, like implants, like veneers, or like tooth whitening. That is something that is not covered. But the list of things that are is pretty amazing. Luis?
Elaine, there's something I would like to note, because I had a case that I worked early this week, and perhaps so this would be beneficial for the group.
Yes.
What's your take on people that have dentures? Should they see a dentist every year?
I think they should for an oral exam. As I mentioned, only because you want to make sure that the gums are in good shape. For instance, if someone's a smoker and they have dentures, you want to make sure those gums are, you know, healthy. So just because you have dentures doesn't mean you should ever visit a dentist. You know, they also want to do like an oral cancer screening, just to make sure that your gums, your tongue is okay. So I would say at least once a year, just walk in with your dentures, make sure they don't need to be adjusted or something. So yeah, absolutely. Good question.
Yeah,
good point, Luis.
That was the same comment I got from Dr. Hamad, who was seeing this patient, but he was under the impression that he got his full dentures delivered. He had no longer the need to see the dentist, and nope. He said, you need to come back at least once a year to do a checkup.
And, you know,
we may not do a dental cleaning, but you need something else.
Right. I was going to add that if you're on certain medications that cause dry mouth, or
Correct.
some other issues that might bother your mouth, you know, that's good to note, because that can be rectified.
Thank you, Lane. So I'm going to translate that into Spanish.
Okay.
All right. Perfecto. Entonces, acá vamos a dar un resumen de sus beneficios dentales cuando usted está en el programa de Husky. Básicamente es los exámenes que ocurren cada año o cada 2 años. Recuerde que si usted tiene Husky y es adulto, tiene la visita de una vez al año. Si usted es un menor de 21 años, usted puede tener la visita o puede tener la cobertura 2 veces al año, o sea, cada 6 meses. También cubrimos los servicios como los selladores o los sellantes que tapan las ranuras de los dientes o muelas, radiografías, los empastes, no sé cómo le dicen en otros países. En mi país le dicen curaciones, en otros países le dicen calzas. También tenemos el servicio de las extracciones en caso de que sea necesario. El programa o los dentistas del programa tratan de siempre salvar los dientes, no tratar de removerlos, ¿ok? Importante, el servicio de prótesis dental, ya sea parcial o dentaduras completas, es cubierto una vez cada 7 años. Así es que es importante que si usted obtiene dentaduras con el programa, sea responsable y cuidadoso con ellas. Trabajos del conducto, también conocidos en inglés como root canal, las coronas, cirugía dental si es que es necesaria en casos de que usted tenga dientes molares o del juicio que estén impactando o causen dolor. Y el servicio de ortodoncia, que lo respondimos en la pregunta anterior, que es con una autorización previa y requiere la obtención de cierto puntaje, en este caso 26 puntos para arriba. Y la indicación de que si usted tiene dentaduras, ya sean parciales o dentaduras postizas completas, es importante que aún usted tenga esto, visite al dentista por lo menos una vez al año. Pueden haber cambios en sus encías, pueden haber cambios en la medicación que afecten su salud bucal, así es que es importante ir al dentista. Okay, Elaine.
Okay. So, this is called the ABC program. What it is, fluoride varnish. And what it is protection for your child's teeth. And it's a program that is also covered by Husky. It's when a child it can be done in conjunction with a child going to his or her pediatrician. And the fluoride varnish will be brushed onto their teeth. So that's something that if you're bringing your child to their next pediatric visit, mention the fluoride varnish. That's something that can be done very easily, very quickly, painlessly, and it's another good way to protect your child's teeth. As soon as they erupt, you want to, take care of that. So ask your pediatrician about fluoride varnish. It's very important.
Thank you, Elaine. Ok, ahora vamos a hablar acerca del programa de ABC. Es básicamente nuestra iniciativa de usar o pedir el flúor, el barniz de flúor en la visita médica de su niño o niña. Esto ocurre básicamente cuando usted visite a la oficina pediátrica y el doctor, ya sea el doctor, la enfermera o una asistente de médica, le va a realizar la aplicación del flúor en los dientes del niño. Esto es un motivo de prevención para que los dientes no obtengan caries. Esto ayuda a fortalecer los dientes, o mejor dicho, el esmalte de los dientes para que los dientes no reciban picadura. Pero nuevamente es importante el cepillado. Vamos a hablar acerca del cepillado en unos momentos. All right, Elaine.
Thank you.
Mm-hmm.
Okay, so... Oh, is there a question? Yeah.
We have another question from
Sure.
a participant. They're wondering about at what age, it was the fluoride varnish, I think. At what age can a child get that, or when should the parent ask for that?
Well, I think the rule of thumb, and Louise correct me on this, as soon as the child's teeth erupt.
Yes.
I think that is when you need to ask for the fluoride treatment. It's also when the child should see a dentist. Even if there's, one tooth sticking up, still go, because what you want to do is get your child used to seeing the dentist. It's very important. If you try to bring your child to the dentist when he or she is 10 years old, it's not going to go well. You want to do it as soon as you see a tooth come in. Mm-hmm. And that way the child will be sort of desensitized to and used to having, a dentist putting their hands in his, the child's mouth. But as soon as the tooth erupts, that is when you should ask about fluoride. Luis Miguel, have I got that right, I hope?
Totally. And that goes along with the Home by One program, which actually motivates parents or caregivers to take their children at age 1 or whenever the baby tooth erupts to see the dentist for the first time.
Mm-hmm. Maybe translate that for us. Yeah.
Yeah. Entonces, yeah, I'll do that. Because this is being recorded, so I think it's going to be beneficial for the future. En caso de que la pregunta fue, ¿qué tan pronto puede el bebé tener el servicio de barniz de flúor? Bueno, Elaine respondió que, y está correctamente, que tan pronto como el primer diente salga. Entonces, de la misma manera también es importante que los padres o los que cuidan los niños lleven al niño al dentista conforme el primer diente salga o al cumplir el primer año de edad. All right. Thank you, Elaine. All right.
Thank you. Okay.
Get my slides. Right. Okay.
Okay. Yep. So, what does oral health look like? I can't tell you how important it is to have good oral health. You think about it, your mouth is not separate from your body. It is part of your body. And so if you broke an arm or you needed to go to, get your, whatever, your heart monitor, you want to pay the same attention to your mouth as you would any other part of your body. A healthy mouth allows you to eat, which is so important. When you have bad teeth, you're not able to eat. I mean, that's a horrible thing. Who doesn't love to eat? So that's important. It helps us eat, speak, and smile without pain or embarrassment. I mean, sometimes you'll see people that their teeth are in horrible condition and they'll put their hand over their mouth, or they'll sort of look away, or their self-esteem is low. And that can be taken care of, Bad breath, halitosis, that's a condition that can be easily corrected. Keeping your natural teeth is so important. Everyone thinks, oh, I'm going to get dentures. I'm just going to have all my teeth pulled out, or I'm going to get implants. There is nothing like your own teeth. No mistake about it. You put dentures in your mouth. Some people need to get dentures, but it is a foreign item, a foreign thing in your mouth, and it's not the same as your real teeth. So at all costs, you really want to take care of your teeth and maintain it. And Husky is the plan that covers so many things for you. It can help control medical conditions and illnesses. When you have poor dentition or a lot of cavities, I mean, that is going through your bloodstream. That can affect your heart. That can affect so many things about you. It can give you, it can travel to parts of your head, parts of your brain. I mean, you can get headaches that are caused by impacted wisdom teeth, that sort of a thing. And most people don't think about that, but your mouth is part of your body, and it's an important part as well. As I mentioned before, helps your well-being and mental health. When you're embarrassed of the way your smile is, that sort of cuts you off from people. You're embarrassed to be with people, you're embarrassed to talk, you're embarrassed to smile, you have trouble eating. I mean, those are things that nobody should have a problem with. Importantly, it helps you have a healthy baby, because if you have a mouth that's really carious, or you have a lot of issues going on, it's easily passed on to your child. You have germs in your saliva that you can easily pass on to your baby. If the baby drops their little binky on the floor, you pick it up and lick it off. Those are germs you're passing on to your baby. So you want to look at this as holistically as you can. And Husky is a plan that can really help you address all of these issues. Luis, up to you.
Thank you, Lane. Ok, vamos a darle un poquito más de información acerca de cómo es una buena salud dental. Bueno, básicamente tener una buena salud es aquella la cual nos permite comer, hablar y sonreír sin tener dolor ni vergüenza. Una cosa importante es que una buena salud oral es también aquella la cual no tengamos mal aliento. Esto es y si usted ha tenido o ha sufrido de este malestar, es corregible a través de mejorando la técnica de la higiene. Otra importancia es que la buena salud dental nos ayuda a conservar los dientes naturales por toda la vida. Así es que no crean ese mito de que conforme uno va envejeciendo, uno tiene que perder los dientes. Eso es falso. Los dientes están para durarnos durante toda nuestra vida. Nos ayuda básicamente a mantener el bienestar y nuestra autoestima en cuestión de salud mental. Es aquella también que si tenemos una buena salud dental, va a ayudar a que tengamos a una madre gestante tenga un bebé saludable. Ha habido investigaciones y a través de artículos científicos de que si una madre gestante tiene mala salud dental, tiene el riesgo de tener gingivitis gestacional, la cual puede tener dos resultados adversos, el cual es los bebés con bajo peso y la prematuridad en los niños o en los bebés. Así es que acuda a un dentista, tenga los servicios de prevención, nuevamente, limpieza y examen. All right, Elaine.
Okay. So a daily routine, and you should practice this, without, no mistake about it. Brush your teeth twice daily. and that includes using dental floss. Dental floss is, I use it, without even thinking about it. So brush twice and also floss, that's real importantly. And brush properly. Get a soft brush. You don't want to get this hard one, and you don't want to just brush your teeth like there's no tomorrow. Small circles, very gently. Your gums are very sensitive, so you want to make sure you get a soft bristle brush. Adults should help their children up to age 7 or 8 with brushing. It doesn't have to be a big production, but you just want to be next to them and kind of guide them a little bit, show them how it's done. Make it fun, reward them, not with candy, but with, something else that, use a fluoride toothpaste. Yeah, you want to get fluoride into your mouth. That's a good thing. If you can use mouthwash before brushing, that's another good thing too. It sort of loosens up the particles. And as I mentioned, floss daily, 3 or 4 times daily. That is so important. Luis?
It's actually critical to floss.
Critical.
Yeah.
Muy importante. Sí. Yep.
All right, let me move on to the Spanish version. Thank you, Lane.
Sí.
Estos son unos consejos acerca de la rutina del cuidado diario. ¿Ok? Básicamente, es importante que se cepille los dientes. ¿Cuántas veces al día? 2 veces. Puede hacerlo una tercera vez entre comidas, muy bien. Pero lo que se recomienda es 2 veces. Una por la mañana, justo después de levantarse, y otra antes de ir a cama. La importancia de cepillarse correctamente no es usar mucho esfuerzo, no es usar las cerdas más duras, al contrario, es usar movimientos en círculo con un cepillo que tenga las cerdas suaves. Requiere tiempo, por lo menos dedíquele 2 minutos, ¿ok? Hay un pequeño consejo el cual puedo darle, es que podría cantar la canción de Feliz Cumpleaños 2 veces. Este sería los 2 minutos. I think you got that right, Elaine. All right.
That's
If Elaine's laughing, then
perfectamente.
it's a good tip. All right. Use cepillo dental que contenga flúor. Esto es un material o ingrediente el cual ayuda a proteger los dientes de las caries. ¿Ok? Esto es otra cosa que me olvidé de mencionar, es que los niños deben de tener el cuidado o ser monitoreados por una persona adulta hasta los 7 u 8 años. Otro consejo es que un niño no sabe cepillarse bien si es que no se puede atar los pasadores o los ¿cómo le dicen en otros países? Creo que también le dicen ajuletas, no me equivoco, no sé muy bien pronunciarlo, pero si es que el bebé o el niño no puede amarrarse los zapatos, no puede cepillarse por sí solo, necesita la ayuda de un adulto. Es importante el enjuague bucal y el uso del hilo dental todos los días. Es crítico porque nos ayuda a limpiar entre los dientes donde el cepillo no llega. ¿Ok? All right, Elaine, you're next.
Okay. Okay. Routine care is very important. Going routinely to the same dentist. And as I described, it's a dental home. You don't want to bounce around from dentist to dentist. They're not going to tell you anything different. You're not going to get any different coverage. Your Husky coverage is the same. Having a dental home, the same dentist, they get to know you. They get to know your mouth. You feel comfortable there. They'll provide you preventative, acute, and comprehensive health care. Do not wait till things hurt. When it hurts, that complicates things so much. You're putting yourself at risk. You are making it much more difficult and painful than it has to be. So getting a routine schedule is really important. As soon as you feel any kind of pain, give us a call. We'll get you in. It could be an abscess. It could be some kind of decay, something that was overlooked or something that just happened as an accident. Really, really important. Don't go to the emergency room. You are not going to get any kind of dental care in the emergency room. Right now with COVID, they are overwhelmed. They will see you and say, after sitting there for 3 hours, you need to make an appointment with your dentist, and they'll dismiss you. So do not go to the emergency room. You will not get any kind of dental care there, and they will not give you any kind of pain medication. They will tell you to see your dentist, which is kind of what we are there for. So that's very important. Luis?
Thanks, Elaine.
Hmm?
Ok, entonces vamos a hablar acerca de cómo hacer mejores obtención de una rutina de cuidado dental. Es importante de que obtengamos servicios dentales en una misma oficina con un dentista con el cual ya nos sintamos cómodos. No estar yendo de oficina dental en oficina dental. A veces sí nos puede tomar un tiempo encontrar esta oficina que nos conviene y nos sintamos cómodos. Pero una vez que ya haya establecido su dentista, acuda a él. Acude y recibe los cuidados rutinarios que si es que eres un adulto, cada año te toca o cada 6 meses en caso de que seas un menor de edad. Por favor, no espere hasta tener dolor. Acuda al dentista una vez se estén mostrando los primeros síntomas de incomodidad. Si es que hay un motivo de piensa que en la sala de emergencia lo van a ayudar con un motivo de un problema dental, está erróneo. Eso no va a ocurrir. Especialmente en tiempos de pandemia, las salas de emergencias están totalmente ocupadas con casos y gente que necesita atención médica urgente. Así es que si es que usted acude, lamentablemente no van a hacer mucho por usted. Lo que le van a indicar es que acuda a un dentista y obtenga servicios dentales lo más pronto posible. Y acá, en este caso, estamos nosotros para ayudarlo. Puede acudir a nuestro centro de llamadas o a nuestra página web y nosotros le podemos brindar ese tipo de ayuda. All right, Elaine, you're up.
Okay. Diet is very important. Limit sugary foods. Sugar is probably the worst thing you can eat. Sugar has the same chemical makeup as cocaine. There's like one, it's very similar, and it's addictive. And I am guilty of eating too much sugar. I think everybody is. So try to avoid or at least cut down on that. I don't know if you can eliminate it. If you can, let me know how you do that because that's so hard. Avoid sugary drinks, soda. A lot of juices have high fructose corn syrup in it. Best thing to drink is water. Just really pay attention to the labels, what's on back. If you see sugar as a main ingredient or high fructose corn syrup, chances are you don't want to be drinking that, okay? Drink lots of water, best thing to drink. Lots of fruits and vegetables, very important. Avoid smoking. I don't even see people smoking anymore. When I do, I'm shocked because that is so bad for your health. And I hope we've learned something by now. It can affect you in so many ways. So those are just rules that you really should follow as much as you can. Luis?
Thank you, Elaine. Well, let me share this with you. As time changes, yes, I don't see people smoking, but you know what I see? I see people vaping a lot.
Vaping, yes.
Yes. So that there hasn't been much research about it, but I think that can be as harmful as smoking. So
yes.
Look, it's not going to help you have a good oral health.
Right.
All right, let me just go into the Spanish version. Perfecto. Una dieta saludable básicamente es tratar de evitar o reducir el número de alimentos azucarados. No estoy acá para prohibirte el consumo del azúcar, pero te quiero decir lo dañino que es el azúcar y nocivo. En realidad, nosotros consumimos azúcar a veces sin darnos cuenta. Lo podemos ver en los alimentos que comemos en la mañana, desde ya sea un jugo de naranja o de china, como usted lo diga, dependiendo de dónde es. Está ahí puesto como un ingrediente añadido, porque básicamente un jugo de naranja no contiene el monto de azúcar si es hecho naturalmente. Y lo vemos a través de nuestras comidas durante todo el día. Así es que es importante evitar el consumo de este ingrediente. Por lo tanto, no hay mejor solución de tomar agua diariamente. Incluso si es que usted vive en una zona o en un lugar donde el agua es tratada y el flúor es obtenido a través de la compañía de agua, pues tome agua de la pluma sin temor de que esta le pueda causar mal. Está tratada, está aprobada por los servicios de agua, dependiendo de la ciudad o pueblo que viva. Trate de comer o incrementar el consumo de frutas y vegetales. Y algo importante, evite el fumar. No solamente es dañino para su salud oral, es dañino para su salud en general. Okay? All right, Elaine, you're up.
Okay. Okay, tooth decay. Tooth decay is the #1 chronic disease in children in the United States. A lot of kids, don't ever put your child to bed with juice in the bottle. If anything, or even milk, there is, lactose in milk. You want to put them to bed, if they have to have something, water in the bottle, because that sugar coats their, teeth all night long. Caries are rampant. So #1 chronic disease. They'd miss a lot of school from that too. 5 times more common than asthma, 7 times more common than hay fever. So in following the steps that we mentioned in the previous slide, brushing, flossing, avoiding sugar, you can hopefully keep this in check under control. So it's very important. Luis?
All right, thank you, Elaine. Acá les vamos a dar unos pequeños datos acerca de cuán frecuente o cuán común ocurre las caries comparado con otras enfermedades. Con decirte esto, de repente te puede sorprender, pero básicamente es la enfermedad #1 crónica en los niños. Sí, tener caries es una enfermedad. A veces se cree que porque es un daño que ocurre encima de los dientes, no puede ser concebida como una enfermedad, pero te lo digo, el tener caries es una enfermedad. Es como tener una lesión o una herida abierta en tu piel. Eso es básicamente la analogía que te puedo dar. Así es que, si es que tienes esto, por favor acude, o has visto esto en los niños o en la familia, por favor acude al dentista, que esto es prevenible. Nuevamente, las caries son 5 veces mucho más común que el asma. ¿Ok? Y también es 7 veces más común que la alergia que se tiene al polen. Así es que está muy, muy, muy común entre las familias y pequeños en nuestra nación. Así es que, por favor, el mensaje nuevamente es prevención y tratar de ver al dentista lo más pronto posible. All right, Elaine, you're up.
Okay, so we want to talk a little about COVID-19 and dental health. Certainly want everyone to be vaccinated. Again, don't wait till it hurts. Don't wait till something happens. 211 is a good hotline to call. They have so much information about COVID vaccines, eligibility, location. So, please, use that to your advantage. There's so much uncertainty right now, but the things that are under your control, the things that you can control, the things you can get help with, those are the things you should really take advantage of. So, seek out these groups that can help you, because that's what they're there for, and they do have a lot of information.
All right, Elaine, thank you. Bueno, esto es básicamente otra iniciativa de la cual tenemos, que es durante la pandemia estamos colaborando con otras agencias para brindar la información acerca de la vacuna del COVID-19 y también información dónde vacunarse y obtener estos servicios. Nuestro colaborador #1 es el centro de 211, el cual puede llamar y obtener información día a día, y también acerca de lugares donde se realiza la vacuna. Así es que si no se ha realizado la vacuna o está esperando hacerse el refuerzo, por favor, contáctelos y haga esa cita lo más pronto posible. All right. Thank you, Elaine.
So, preguntas? Please ask whatever questions you'd like to. The number on the screen is the number you should call if you need help in finding a dentist for you or your family or someone that you know that needs dental help. Again, don't wait till it hurts. There's lots of dentists that would be happy to see you. Our call center is happy to work with you. And if your case is a little more difficult, more barriers, that's when you would be transferred to one of the dental healthcare specialists. and we're good. We can help you get to a dental home. So I really thank you for giving us a chance to speak to you about this. It's very important. Luis?
Muchísimas gracias por habernos tenido esta noche aquí y responderle sus inquietudes. Si usted tiene preguntas, por favor, puede realizarlas al chat o a través de Rachel o Adriana. Estamos acá para ayudarlos. Muchísimas gracias.
Thank you both. I have a question for a family that couldn't attend. Elaine Luis, the question is, she has a 25-year-old daughter with special needs, and she's looking for her current dentist. I don't remember if they retired or aren't accepting the insurance anymore, but she's looking for help with finding someone in the Southington, Plantsville, Cheshire area. Is there any way I can kind of connect her with you guys? Because she's looking specifically because of the age, and she's been to one particular dentist for a very long time, but she is really looking for, she's kind of stressed out about it, trying to figure out how she can continue that care. And she doesn't want to just go anywhere. As you know, sometimes we need to, I know I've seen in social media, a lot of parents will call an office and they're like, yeah. And then they go and end up walking out without service because the office wasn't prepared, it was able to provide services. So I thought that's why this is so great that we can connect families that with you and Luis to help, filter out and have that unnecessary kind of waste of time on the practitioner side and on the family side.
Sure.
So
the 25-year-old young lady, what sort of is she on the autism spectrum? Does she have what's going on?
Yes, I believe she is on autism spectrum, and I didn't get the rest of the details, but she did want me to just present that question. They were not going to be available, but I said I would ask and kind of put you in connection with her. And it is one of my Spanish-speaking family, so it'll probably, might be Luis. And then I'll just, since it's being recorded, I'll tell the question in Spanish. So la pregunta que estoy preguntando a Luis y Elaine es de una familia que no podía asistir al taller, y ella tiene una hija de 25 años de autismo, y ya el dentista donde estaba asistiendo, la hija ya se retiró y ya está buscando un dentista en Southington, Plantsville, Cheshire. Claro que está buscando ayuda porque la hija tiene necesidades especiales y quería conectarse y preguntar cómo Connecticut Dental Health Partnership, Elaine y Luis la podían ayudar. So, sí, la pregunta la hago en español también, Luis.
No, muchas gracias por la pregunta, y básicamente Elaine preguntó si es que la niña, o en este caso la adulta, tiene problemas dentro del espectro del autismo. Estaríamos, si es que esta persona tiene el programa de Husky Health, claro que sí, estamos dispuestos a ayudarlos. Elaine, I think we agreed to reach out to the family and we can help them find a dentist, right?
Of course, right.
All right.
Yeah, no problem.
Sí, no hay problema. Con gusto.
Muchas gracias. Thank you.
De nada. Sí, de nada.
Great presentation. I must say, I love listening and learning. And if any of the families want to unmute and ask a question, feel free, or even just say something positive. I think Luis's iPad is raising her hand. Yes, go ahead. You're unmuted.
Is this for me, Louise Broder?
Yes, it is.
Okay.
Hello.
May I actually ask 2 questions? Would that be okay?
Oh, yes, of course.
Sure.
Ask as many as you'd like.
Wonderful.
No limits.
Anyone who knows me can't believe I would only limit my questions to 2 because I'm a known questioner.
Okay.
My first question is, I was just looking for a little more clarification on the fluoride varnish. Is it done a second time after the initial eruption of the tooth, or is it one and done?
Luis, do you know the answer to that? Because I don't.
From my understanding, the fluoride varnish can be done multiple times. I think up to 2 times a year.
And that would be
Okay.
covered by Husky Health if it's twice a year?
It will be covered by Husky Health, and I think there's a limitation up to the age. I'm not sure if it's, I will have to double check because it's from, I'm not sure if it runs all the way up to 16 or 15 years of age, Elaine, but.
Right, I think we'd have to ask maybe Leland about that, and we can let you folks know what the answer to that is. I'll make sure I ask her that.
Yeah, we will get
That's
back
wonderful.
to you regarding the
Yeah.
frequency of fluoride varnish. Yep.
That sounds wonderful. And did
So-
I understand that it can be done at the doctor initially versus the dentist?
Yes.
Correct.
That is correct. We try to, make it convenient, and it's something that the pediatrician can do very easily. It doesn't have to be
Okay.
done by a dentist. So yes, that is,
Okay.
yeah.
And my second question is broader based. I'm a service coordinator for an early Head Start and Head Start program in 2 counties. And one of the questions that I often am faced with is there an existing list through either the Connecticut Dental Health Partnership or another organization in the state of Connecticut that lists either practices or larger dental corporations or organizations that are skilled in working with children who have, or adults, various special needs? I'm aware of several just from having folks in my life. I know St. Francis, a lot of them are affiliated with big hospital programs like St. Francis, Yale New Haven,
Right.
to name Yukon Dental has a great one. But for some of our families, obviously transportation and the location is really difficult. We're sort of, as we like to say, the right side of the river versus the other side of the river. And there's
Right.
not a whole lot of folks that we know of. So is there a list that is available of folks to consider that are skilled in this area?
Well, a couple things. We do a survey every year with our dental providers to check in and see who handles special needs clients. You're right.
Mhm.
All of the hospitals do that because they have the capability of one-day surgery.
Right.
But one-day surgery is a last resort. They always want to try to see if we can do it in the chair. Because as you know, going under general anesthesia poses certain risks. So all of the hospitals can do that, at least the ones that participate, with the Husky plan. There are some private dental providers that are well-versed in handling clients with special needs. It's a little more difficult after age 21 because one of the things, and we've been working on this for decades, is the reimbursement rate. The reimbursement rate is much higher for children, adults not so much. So that poses an issue. But for instance, when I get a special needs client who's over the age of 21, my first go-to is usually the hospitals. They're equipped to deal with a person, but that's not to say they're going to need one-day surgery right away. That may not be, the case. But if you were to call our call center, they would be able to search in an area. And if you're looking for special needs providers, they would have that answer. We don't have a list typically because oftentimes if a provider has more Husky clients that he can handle, he may have to close his panel. So that's why the call center is sort of the gatekeeper of that. But certainly, you can call me directly if you'd like, and I'll see what I can do. I mean, sometimes it's a challenge. It's not easy. That's why we really try, and I know this is sort of maybe, Monday morning quarterback, but we really try to have kids see the dentist by age 1, by age 2, to sort of desensitize them. But a lot of the adults that are special needs never had that luxury. So what you have to do is do the best you can. I mean, I know clients that go to one-day surgery at Yale, some of the young ladies that have special needs, they may go under one-day surgery and have their dental, and then they may have gynecological things done because they need to sort of, give them the least amount of time under general anesthesia to get as much done as possible. So those are sort of the issues that you're faced with. But if you were to call our call center, they would have a list of dental providers that could see. And if it's something that's really monumental, then that's when we, refer them to some of the area hospitals.
Do you have
So
the number
not-
for that call center? Elaine?
Yes, it's right on the screen here.
Oh, I'm sorry.
That's okay.
Okay,
And if it's something that they can't handle, then it will come to me. But the call center is pretty well versed. You know, they do have a lot of resources at their fingertips.
okay. Thank you.
You're welcome.
Does anybody else have a question, comment? Was this useful, helpful? Oh, go ahead, Rachel.
I just wanted to make a comment about the fluoride varnish that my son is on Husky insurance and he's been able to get the fluoride varnish twice a year at, each of his exam and cleanings with no issue with the insurance.
Great.
Wonderful.
Great.
Thank you.
Yeah,
Good.
You're welcome. We did have another question. Someone had asked me, but then she had left, if we were going to email out the recording, and we can definitely do that to anybody that participated today.
Mhm.
And then, like Adriana says, are there any other questions or comments?
If you find there are questions after this is over, please email them to us. I'll find out the question. Well, I guess we did answer that question, but I'll just about fluoride varnish, but I'll confirm that anyway. But if you have any questions, feel free to email them to us. We'll do our best to answer them and get back to you.
Thank you. All right. Are we good? Anyone else?
I just wanted to let everybody know that we're going to be sending you, after this workshop is over, you're going to get an email with a link to a survey, and basically let us know. It's going to ask you how you liked the event. Also gives you an opportunity to make suggestions for future topics that you'd like to see us present on. Also, would you like to see further education workshops around dental health, things like that, because we're here to serve you and really support you, and we want to hear from you so we can further give you topics of interest that you want to know more about. Después de este taller, lo que vamos a hacer es mandar un correo electrónico con una encuesta que te va a preguntar a través a ver cómo le gustó el taller, cosas como vas a tener una oportunidad a dejarnos saber qué información le gustaría ver que presentamos en el futuro, más si quieren más talleres en salud dental o otra información que te gustaría. Es el momento de dejarnos saber, porque estamos aquí para apoyarlos y para poder darle la información que los va a ayudar lo máximo. Entonces, para eso estamos, para servirlos.
Okay, well, again, thank you for the opportunity, and I hope people will learn something from this.
Yes, thank you. I thought it was
Yes,
wonderful.
thank
You and
Good.
Luis Miguel did such a great job. Thank you so much for presenting to our families, and really excited in this collaboration and hopefully future collaborations.
Well, you're welcome. You're